Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself.
Welcome back to the Beauty Equation, where we have real conversations about real issues in medical aesthetics to help keep you informed about what is going on in our world. I am Dr. Harpreet Lotay.
And I'm Dr. Christelle Oliver-Dussault.
And I'm Amanda Manholt.
And I'm very excited about today's episode because we have a special guest. Her name is Dr. Amber Bocknek, who I met in Puerto Rico during a trip where we were learning about bioregenerative treatment, specifically Radiesse, and we just hit it off. She is the owner of Thrive Med Aesthetics in Aurora, Ontario, and she has a YouTube channel called Longevanity, where she talks about aesthetics, menopause, all things that many of our listeners would be very interested in. And she has a book, which I just love the title of, called Hot Flash to Hot Damn. So welcome, Dr. Bocknek.
Thank you. I'm so glad to be here today. Thank you for the invite.
Of course. We have lots and lots of questions for you. Perimenopause and menopause is a stage that is marked by a lot of changes. You know, a lot of people will talk about hot flashes, sleep issues, general change in mood and anxiety. But from an aesthetics perspective, there are also some changes that are quite stunning, shall we say. So I'd love to hear what you see in your patients. What are some common concerns? We'd love to chat about that.
Absolutely. So as you rightly identified, the hallmark of that time of life, as we're all kind of going through it, is change. And so with the decline of the hormones, you really do see changes in the skin as well, too. So sometimes you see accelerated skin aging at that point. The skin looks thinner, drier, it's more irritable, it starts to become crepey in all those areas that you never knew could become crepey. It's so funny. I think I represent my own patient population. Just this weekend, I'm sitting on the sofa with my husband with my one ankle crossed over the other. I look down at my legs in horror and I'm like, oh my God, I have like crepey old woman skin. When did this happen? And how have I not managed this? It's like, oh, me too. But yeah, so again, there can be quite a bit of change. So the hormones, again, I think it comes a bit of a surprise to some of my patients. I don't know if you've had these conversations in your respective offices, is that estrogen receptors aren't just in breasts and uteruses. They're everywhere, including the brain, the bone, and the skin. So we do see absolute visual signs of aging with fluctuation and loss of hormone. I don't know what you guys hear in your office, but for sure the struggle is real.
Yeah, we do notice that quite a lot. It's a slow decline in the 40s, and then oftentimes we'll get women who've never sought any form of aesthetic care and around menopause in their early 50s. And the common line we'll hear is, I feel like my face just dropped.
Overnight. I think that's the big thing, and we do this all day and we look at faces all day. So at first I thought it was really interesting when someone said to me, I didn't look like this last year. But then I hear it over and over and over again. I don't know what happened.
It's a huge rapid decline. I think it's something like 30% in the first 5 years, collagen loss. So it's startling, right? And you can tolerate a little bit of loss, just like as if you're sort of going down a bit of a slide, but then you hit this sort of break point where it's like falling off of a cliff. It's like huge in terms of the impact. And we do see a lot of people who are not your typical aesthetic person or not someone who gets Botox, but it becomes so distressing for people because what they see in the mirror just doesn't really match how they feel inside. And I often say that by the time you hit perimenopause, menopause, you're sort of good in your career. You feel like you're at the top of things as far as that's concerned. You feel confident about many things. And then your reflection doesn't match how you're doing inside in terms of that mastery of other aspects of your life. And it's super distressing. And, it's like one step forward and you've got this thing dragging you back, and also the physical changes that happen, right?
Absolutely. I think image alignment, really, you hit the nail right on the head. It just doesn't align anymore. And I think for some people, it's even one step further where all of a sudden you look in the mirror and you see this different face looking back at you, which is older. And it reminds you that there's only so much sand in the hourglass. And that again, we're on the second half of the game. So it can be a little bit distressing that way as well too. It creates a sense of urgency, the sense of not being aligned with self. It can be frightening. It's a lot of emotions, I think, that come with it. It's not about vanity. It's about all these other messages that it gives.
Yeah. So how do you approach it? What's your first step when somebody comes in and they're perimenopause, menopausal, their hormones are impacting their aesthetics? Do you kind of do both at the same? Do you address their aesthetic concerns first? What's your general approach? Love to hear that.
So I like to meet, especially a newer patient. To me, I think it depends to how established of a relationship I have with them. I really find a newer patient to the practice, it's just, from my perspective, it's so important to meet them where they're at. So it's that whole patient-focused care approach. Well, what do you see and what's concerning you? And so we sort of start from there, and then it's like the onion where you peel off the layers. And so we may start where the original item or problem was that they noticed. But then part of the natural discussion about that issue sometimes gets to root causes. Well, what's actually driving this? Because at the end of the day, to be most successful in meeting that specific need that they came in with, we sometimes have to actually identify that it's actually due to alternate things. And then we have to kind of address education and treatment targeting around that. So that seems to be how we go. A patient who's like a longer term patient who's been with us a long, long time, sometimes it just sort of naturally comes up as part of process. So I think it depends on whether they're new and we have an established relation or versus an established relationship with them. What about you guys? Because again, it's a complex question.
So Christelle might have access to a different approach, because although I'm family practice, my main focus is aesthetics. So when a patient comes in, as you say, we're going to meet them where they're at. So if they're worried about their 11s or their crepey skin, we're going to use modalities that impact that. But all of us know that there's also those hormonal changes underlying that are contributing to that. So yeah, we're going to address the root cause if it's the 11s or lines by using neuromodulators or muscle relaxers. But at some point, you are looking at the whole person and you're thinking this person really could use some hormone replacement. We don't have a huge amount of data around how that replacement impacts skin. However, it makes a lot of sense. And now people are using different estrogen creams and things like that. But ideally, you'd want to partner with someone who could also support their hormonal health. And, it's nice that in your clinic you have both options.
Yeah, I'd love to hear more about that, because the way it works for us now is that I'll have these conversations and inadvertently hormone placement comes up in its various forms and the changes that they're noticing. And it's not uncommon that I will say to them, or I will take their details and I'll link them in through the clinic that I run family medicine residents, because of the community we live in. Most people don't have a family doctor, so they can't access a family doctor who may do hormone replacement, or they don't even have access to someone to refer them to someone who would provide those types of services. So that's something that kind of comes up almost on a backdoor and in conversation, being like, well, we can address in this setting the what you're noticing it's happening in the skin, but from everything else that you've mentioned in our conversation, we shouldn't ignore that. And this needs to be, sometimes it needs to be investigated. We need to really look at the whole picture and let's link you in that direction to do that. So how do you marry that in your current practice where you offer both services?
Yeah, I know. It seems like a kind of a quirky little twist, but when you look at it the opposite way, for me, it's very much inside out anti-aging. So addressing the hormonal things that are happening is actually addressing the aesthetic things that are happening. And it's, like, again, it's an interesting transition for me because I have a family practice background as well. Originally did a lot of work with women. I'm a 1996 grad, so I'm dating myself a little, but the important thing was it was pre-Women's Health Initiative, and I was extremely pro hormone replacement back then for the cardiovascular, the bone, the cognitive, all the things we believed. I actually spent time when I decorated my first office on one wall in each room. I had a wall just dedicated to hormone replacement benefits, all the different reasons to consider it. And, when the Women's Health Initiative hit, it hit hard and it created so much fear and we yanked everybody off. And at that same time, I was doing a little bit of a cosmetic practice, but I was so, chronologically young back then. I was like in my late 20s, not really experiencing any of this firsthand. I was more concerned at that point from my personal use and interest. All of these things have come from personal things, the cosmetic stuff, a little of the neurotoxins, some laser, that kind of thing. I never really put two and two together. As I've gotten older and these things have been happening, it's kind of like my old lady skin moment on the couch where I'm like, oh my God, what is this? So it's one thing to see people as patients, but it's another thing to kind of experience it and go, holy, like I thought I was sympathetic before, but I really didn't fully understand the magnitude of this. And now that I have that, I become a lot more interested in the whole hormone story again, especially as there's been so much emerging data around the flaws in the interpretation of the Women's Health Initiative that led to all the fear and the abrupt withdrawal and me taking all of that educational stuff off my walls, to now where, again, we're very strongly in support of it in broader circumstances than we were before when we do it appropriately with best practices. So that has kind of become like my own aging journey along with the evolution of the medicine. All of these things have kind of coincided. And so now my priority, as my sand is leaving my hourglass, is I want to slow that down. Physically, I want to feel young and I want to look young and I want that full image alignment experience. So again, when I look at my hybrid practice of both, I don't even think of it as a hybrid anymore. I just think of it as a continuum. So the outside is just a continuum of good health on the inside. And when we take care of ourselves from a hormonal, a metabolic, a cardiovascular point of view, we have all round better function, better, healthier skin. We look better. We have more muscle mass, all these different things. So the outside manifestation of us is more aligned with the inside. So again, this whole inside out alignment, I think now fully fits with my truly non-hybrid, but now more continuum practice of both. So I think this is how I've kind of philosophically reconciled it. But I wish I could say I had the foresight to understand it prior to experiencing it, but really it was the experience myself that made me much more sensitive and much more aware. But again, I'm trying to do something with the awareness. So that's how I kind of marry it in my own office, if that makes sense.
Yeah, it makes a lot of sense inside out. And I think as family practice physicians, that comes very naturally to us. But there are challenges when, just as you mentioned, when you have a study that made such an impact and really did stop the progression of women's health, even though its intention was the opposite.
And it's just a tragedy, really, an absolute tragedy.
So we're lucky that some of that is reversing. And now, just in time for our transition, we have access to these things. But,
I'm on a personal, I was mentioning to these guys earlier, I'm on a personal crusade for anybody I know, to any friends or acquaintances. Are you on hormones yet? You're not? Okay, this is what you need to do. Like I've got, so far, I was just saying in the last month, I have 3 friends that are on hormones because I've been pestering them. Was chatting with one the other, because I check in on them like I'm their physician, which I'm clearly not. And I checked in on one the other day, and she said it was so strange. It was about 2 days after, starting with the estradiol or the estrogen patch and the progesterone. She said, I was sitting on the couch and I had a moment of like, oh, there you are. And I get goosebumps because I think how awful for people to be suffering, right?
Yeah. And it happens so insidiously for some that they don't even realize how far they've come from themselves until they finally get to that point where they can't take it. They're at their breaking point, and they've been just putting up with it for months, if not years. And it's harmed their relationships. It's taken enjoyment and stolen time from them. So yeah, it's a real thing. And it's very much like you said, that's one of the parts I find so gratifying is when I start to see people back who go and engage on this journey, is that moment of, oh my goodness, like here I am again. I feel like myself. I've got my life back. I've got my relationship back. I don't want to murder my husband and my coworker and my children. I actually love them. It's like, it's kind of like we kind of laugh about it, but it's like, yeah, I was feeling a little murdery. Did you not see the crazy that was there? Because it was right below the surface. And I'm like, yeah, girl, but you look good now. Like, I feel good, but it can really be a game changer. And again, it's like quality of life, like, right? That's been lost. Our moms missed out on this. We have a whole generation of women who did not have this offered because of the Women's Health Initiative.
Yeah, so true. So true.
It's been the most exciting moments too, when I've been in the rooms assisting the docs. And, I'm thinking of one patient in particular that, Harpreet did a few years. Remember when she sat up on the side of the bed and she looked at herself in the mirror right after we did some dermal fillers for her? Yes. I use collective we.
Yep.
The collective we. Anyway, she sat up, she looks across from her into the mirror and she says, oh, there I am.
Yeah. It's the
Maybe
best.
I will go on that dating app. And she was 65, and we're cheering her on.
Yeah.
And I think that's the coolest part of what we get to do.
Absolutely. Yeah. And that's the other thing. A lot of people think, oh, it's too late, right? It's never too late. And most of our patients who are coming in for the aesthetic aspect of the changes they're seeing, they're not looking to look like they're 20 or 30 or some sort of desperate clinging to youth. That is not the motivation at all. As you said, it's image alignment. And more than that, it's also that we have these micro changes that occur on our facial anatomy that are part of how we age that will translate to emotional signals that we send. So, people end up looking sadder when they're older. They end up looking grumpier as they're older. And it has nothing to do with their internal emotional state or how they actually feel, but it's the structure. So that's the other thing that improves when we use aesthetics in a structural, functional, and anatomic way. We're actually returning people to their baseline so that their emotions and the way they look align as well. And they want to look refreshed. They want to look happier. They want to look more approachable, again, because it impacts relationships, and their perceived openness. So it's one of the most fun things that we do in aesthetics, for sure.
So true. It's that whole conversation around how communication is 80% nonverbal, right?
Yes.
So the body language, again, those lines that say angry, convey something that may not align with that person's personality at all. It's interesting, when we have discussions around wrinkle treatments and neuromodulators, a lot of times the 11s, the angry lines, the squint lines, which again can just be because you need corrective lenses.
Right.
Or again, you concentrate at a computer all day. It doesn't mean that you're angry or unapproachable. So I have some individuals who have lines here and have lines at the eyes, at the crow's feet. Most people are bothered by these, and like the crow's feet are kind of like 50-50. Why? Because crow's feet say happy. These ones say angry. There was a psychology study, I'm trying to remember what year it was, and they were looking at the role of Botox in depression. I don't know if you guys have seen that one.
There's about 4 of them, actually.
Yeah. And so again, I question whether the medication itself actually was an antidepressant, or was it more of the self-talk even in this nonverbal communication. It's like the phenomena of having a good hair day. You know, when you have a good hair day, right? You're not all that different. You still look like you, but you hold your shoulders back. You're queen of the world and out you go. When you have the opposite and you have these deep lines and you look stressed, when you catch a glimpse of yourself in your rearview mirror, on the window pane of a storefront you're going by, in the bathroom when you're washing your hands, you are messaging yourself nonverbally that I am not doing well, I'm stressed, I'm not coping well. So again, I think just addressing some of the things is why this whole nonverbal piece with image alignment inside, outside, or even in these scenarios where they've trialed it with depression, I think part of it is the nonverbal communication piece of it. And I think it's important. It makes people feel better.
Yeah, absolutely. Yeah. And I'd love to hear more about your journey with your book and your YouTube channel and all of that. Your passion for education certainly comes through, and I'd just love to hear a little bit more about that.
Thanks. The book was really fun to write, actually. And I had a lot of fun with the title. I won't tell you the ones we didn't pick unless we're all sitting together with a glass of wine. There were some really funny ones that did not make the cut. But the whole point of the book was to try to make patient-friendly education. For those of us who kind of grew up in the medical world during the 2002 Women's Health Initiative, a lot of the new information is not yet permeated even into the medical community.
Oh, you're right.
So it is hard and frustrating as a patient because social media is loud to try to navigate, well, what is real and what is not. And then you compound that with the systematic problems we have in healthcare. First of all, we don't have enough providers. Second, the providers we have not been offered updated education around the changes in how we view and administer these. And so again, it's very difficult as a patient to find care and find care who has actually been provided an opportunity to become current. So the book is meant to try to empower those people. I have a workbook that goes with it, and the workbook basically is sort of preparation questions for going into your doctor's appointment, how to have conversations around testing, how to understand the hierarchy of these hormones, because there's kind of an order that things need to be addressed, how to look at some of the psychosocial pieces, because one of the things that gets very quickly glossed over in a busy appointment is sort of the interplay between environment and stress and how that can actually impact on hormones. So stress does not just live in your head. Stress can create all kinds of downstream problems that can affect your sleep, contribute to some of the anxiety and other things that we see going along with the hormones. So it's dealing and saying it's just stress is to downplay the hormone part, but to downplay stress and not address stress also does not do credit to it. So it's about trying to understand that that does have a role, and especially for somebody who is very driven, high performing, who lives in a high stress world, to acknowledge that the stress may actually impact on them when they are a master of managing difficult things. Sometimes is an important eye opener. Yeah, I know. Or mine, or looked in the mirror, so this comes again, some of the writing in the book really is about every conversation I've had with every patient who sits in my chair. I swear to you again, because I primarily see women who are of my vintage who are having a lot of these changes. So we do this sort of thing and having all these life circumstances, quasi-adult kids, aging parents, hormone changes, no sleep, relationship, all this stuff. And so we're trying to navigate that. And I'm just doing Botox, but really what I'm doing, the most beneficial thing I'm doing is just listening. And so the book is
and validating their experience.
Exactly. And it's a shared experience. So many people go around in a vacuum, like not even realizing everybody looks so put together and like they have it going on, and you feel like a pariah because you feel like you're the only one who is just faking it. everybody's faking it, or well, the majority are.
Yeah.
And, like everybody's just trying to cope. So the book is really meant to try to bring empathy to self first, empathy to those around, a shared experience, and hopefully some doorways to help people get off that little treadmill of believing that and getting things better. So that was sort of the whole premise behind the book and sort of the rationale. So hopefully it will help reach people in a way that is digestible, understandable, and that they can take, and most importantly, action on so that they feel better. So that's where it came from. But yeah, I
So
had
now
fun
I have
writing it.
something else to recommend to all my friends on
There
my
you go.
personal crusade
Yeah.
to keep us all feeling our best
That
at
sounds
every
fantastic.
aspect of life.
Yeah. So
I
it's
have a
fun.
question for you, which is a bit changing gears, but you touched on social media being really loud and how access to evidence-based information is oftentimes limited and difficult for, everyday women to access. There's a topic that comes up a lot, and that is, using estrogen cream on your face, because we prescribe it for atrophy and skin changes that occur in the vagina and vulval area. And a lot of questions that come up are, well, can I use something like this on my face to address wrinkles? What are your thoughts on that?
So interesting question. This also surfaces in my office too. Harpreet, do you get this question in yours as well from your aesthetic crew? Do they ask you about that a little bit?
Very rarely, but sometimes, yes.
Sometimes, yeah.
I've used it on my neck.
Yeah. So there are estrogen receptors in your skin. So yes, absolutely. We do talk about that. So for most women who are candidates for estrogen, again, you have to have that as a personalized conversation with somebody who knows your health the best. But assuming that they are, let's assume they are, then using it to help stimulate the estrogen receptors in their skin can sometimes be a lovely add-on to the other things that they're doing. So again, that can be in a cream preparation. Estriol is the estrogen that we associate the most with pregnancy, but it also tends to not be implicated in proliferative things. Like, again, some of the estrogens, like estrone, would be one we would not like. Estradiol may have benefits, but estriol tends to be the most safe, I guess, as you want to call it. So as a cosmetic product, you can see that added in. We actually can do that through compounding pharmacies. So you can prescribe that and you can do that. We have a skincare line here in the office, which is almost like a little paint mixer where the base of the cream is just peptides, and then we put individual ingredients in. So it could be a retinol or a niacinamide or vitamin C. And then for these patients, what we can do is actually compound through the pharmacy a little bit of estriol, and then we can add that to their skincare cream along with the other agents, and then we can put the estriol in with it. But even for women who are using something outside of that, it's something you can just have compounded at a local compounding pharmacy. So it's not that hard to obtain. And whether you mix it in with an existing product or you use it as a standalone and you just layer them, it can work very well. And again, just like you said, face, neck, back of hands, my old lady legs, so
Eyelids.
again, those eyelids. Bathe in it. Yeah, exactly. Better life through chemistry.
Right?
So
Absolutely.
yeah, so there's a role for it, for sure. So are you getting asked about that in your practice?
Not too much. It's more I'm seeing it a lot through social media, and it seems to me like it's still very much debated in the medical community. And I think, like many things in aesthetics, it's always quite quick to the forefront, and the evidence is usually slow to catch up.
Mhm.
So there's quite a lot of experimenting that we do in our practice and kind of real life case studies. I don't know if you feel that.
And just like Harpreet was saying earlier before we actually started this call, do you need a study if it looks better and you feel better? I don't know.
I guess. I mean, I think the individualized care really is very, very key. So in any context, whether that be a blood pressure pill, a diabetic pill, or cosmetic cream or a cosmetic product, what applies to somebody else may or may not apply to you. So again, the studies may say one thing, but there are always outliers. What I say to patients is that there are very few certainties, outside of death and taxes. Like seriously, there's no always and there's no never. So again, individualization and personal experience trumps everything else. So completely. Yeah. And that's what makes it challenging and interesting.
Well, I wish we were closer because this has been, I think we're all fairly like-minded. This has been a really fantastic opportunity to sit down and chat. Maybe we'll do it again sometime.
Let's do it again. It was fun.
Very much appreciate it. And until next time, and if any of our listeners out there have any questions, please email us at info@thebeautyequation.com, and we are going to link in the show notes Dr. Bocknek's Instagram, her YouTube channel, and her book. So yeah, check that all out. Until next time, we'll see you then.
Take care, everyone.
Bye for now.
Bye.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.